Welcome students. Today I am going to take anatomy of kidney. Kidney, as you know, is a very important excretory organ. So this is kidney. Also we call it renal, isn't it? So that is why a lot of things are called renal, like renal artery, renal vein, renal fascia, isn't it? So first of all, kidney. And like in anatomy, whatever we talk about, whatever structure we talk about, हमको क्या बोलना है? First of all, the location of that organ, then the shape, size, weight, then the borders, surfaces, or any other structure or characteristic which is going to tell us that yes, this is that particular organ. Okay, so first of all, you can see here, this is the kidney as we see from outside. It is bean shaped, isn't it? But here you can see some lobular shape also, as if some lobes have fused, isn't it? In fetus this kidney is lobular, but in adults it is a single structure, one on the right side, one on the left side. Here you can see two, right and left kidney. So it is bean shaped, you can see it. It is having two poles, upper pole, lower pole. See here whether it is right or left, upper pole, lower pole. Okay, two borders. This is the medial border towards the midline of the body, medial border here, and outer border or lateral border. Medial border and lateral border. See, when we say medial, we have to talk about lateral. If we say inner, then we will say outer. So it has got two borders, medial border, outer border. So till now you are sure about two things, that there are two kidneys in our body and they have two poles, upper pole, lower pole, two borders, medial border, lateral border. And if two borders are there, surfaces are going to be two. Anterior surface that you can see here and the posterior surface that is behind, isn't it? So the kidney, up till now we have seen that kidney is bean shaped. It is having two poles, upper and lower pole, two borders, medial border and lateral border, two surfaces, anterior and posterior surface. Clear? Now we have to talk about the position. Here kidney is present retroperitoneally, that means quite posterior to all the visceral or abdominal organs. So we will describe its position in two types. First of all, in relation to the vertebrae. So the vertebrae in which they are related is T12 and L3, middle of L3. And you can see here this right kidney is little lower here and the left is upper. Why it is lower? On the right side we have got a large organ called liver. So because of that, the right kidney is slightly lower compared to the left kidney, and left kidney is related to spleen, as I have already told you. We will talk about relations later on. But first of all, the position. What is the position? When we talk in comparison to the vertebrae, it is T12 and L3. Okay? Just remember T12 and L3. These two vertebrae. In this relation, we have got this, but this is right kidney is a little lower as well compared to the left kidney. But in abdomen, if we talk about its position in relation to the compartments of abdomen, we have got 9 compartments of abdomen. What are those 9 compartments? Right upper region is called right hypochondriac region, and in the middle, epigastrium. On the left side, upper left hypochondriac region. Then below that, on the right side, right lumbar region, then umbilical in the middle, then left lumbar region. We go down, what we find? Right iliac fossa, then hypogastrium, and on the left side, left iliac fossa. So, in comparison to these 9 regions where it is located, you will be surprised to know that kidney, although it is so small, it is present in 4 regions. How? Because its axis is directed downwards and outwards. That means the 2 upper poles, in this diagram you can see that they are straight, but this is not so. Upper poles are quite near comparison to the lower poles. So we have got like this. This is the axis and this is the axis. Means they are directed downwards and laterally, backwards. Okay? So that is why, because the upper pole is near to each other, they come in epigastrium. So the kidney is occupying epigastrium. Then I have told you this kidney, right kidney, it is pushed downwards because of the liver. And where was the liver present? In the right hypochondriac region, the right lobe, isn't it? Not only in one region, but that was one of the main region. So a part of this is also present in the right hypochondrium. And as this is related to the spleen, we have got a renal visceral impression, isn't it, on the spleen. So it is also present in the left hypochondriac region. So if we make it same, see, epigastrium is the first region, the second region is right and left hypochondriac region. Clear? In middle, below the epigastrium is umbilical region. There also a part of the medial border is present, and the most part is present in the right and left lumbar region. So we have got 4 regions occupied by these kidneys: epigastrium, right and left hypochondriac region, umbilical region, as well as right and left lumbar region. Clear? Now we talk about the dimension. You can see it is long, isn't it? So we will make a little simpler. Okay, see, you just go on reducing it half. We start with the 12. Okay, 12. What is half of the 12? 6. What is half of the 6? 3. But instead of 12, we take it as 11. Okay, 11 centimeter long. Okay, half of 12 was 6. 6 centimeter broad, and half of the 6 is 3. 3 centimeter thick. Okay, it is thick 3 centimeter. So this is the dimension of kidney. Now, the most important relation that you can see here is suprarenal gland on the upper pole. But I will like to tell you first of all the relations, because we should know what are the structures with which its any organs, various parts are related. That is the purpose of anatomy, so that we can know where to operate, how to operate, and if a pain is there or any infection is there or any kind of disease is there, where it can spread, what can be the place of symptom, isn't it? So first of all, I talk about the anterior relation, and as you can see, one is on the right side and one on the left side. So relation will be slightly different but not difficult. Okay, so first of all, the pole. We talk about the poles of both kidneys. Okay, pole is related to the suprarenal gland. No issues about that, nothing great to learn. It's very simple. Both the poles of the both kidneys, right and left kidney, they are, upper pole is related to suprarenal gland. Name itself suggests supra, above, renal, above the kidney. So the upper pole of both kidneys are related to suprarenal gland, also called adrenal gland. Okay, Now I come to the right kidney only. Okay, just focus yourself on the right kidney. So suprarenal gland. After that, what can be related to this area? Liver, because on the right side the largest organ that's present is liver, and we had talked about hepatorenal pouch when we were studying about liver. So this is the hepatic region, and you can see this is the concavity. The medial border is quite concave or C-shaped, and if you have not forgotten, one structure was there C-shaped, and that was duodenum. So this medial border is related to duodenum. Okay, so up till now 3 structures: suprarenal gland, hepatic yani ki liver, and duodenal region. Now lower portion, this below the liver is hepatic flexure. The ascending colon goes up and it folds here and becomes the transverse colon. So this fold comes here, hepatic flexure. So we have got this colic region. Okay, colic region. And as you all know, the small intestine, that means the duodenum, jejunum, ileum, the together are almost 6 meters long. So this lower pole is related to the jejunum. So it has got jejunal region. Clear? So I again repeat: upper pole, suprarenal gland, hepatic area, that means the liver is related. Below it, colic area, then jejunal area, and the medial border is related to the duodenum. So these are the structures which are giving impressions on the anterior surface of right kidney, or we can say these are the organs which are related to kidney, right kidney, anteriorly. Now we come to the left kidney. Now this is the left kidney. Again the upper pole is going to be related to suprarenal gland. No issues about that. And as I have told you in the beginning of the class, that the spleen had renal impression of the left kidney. So that means the spleen is related to the left kidney. So we have got a splenic area here. Okay, splenic area. And spleen was also related to the pancreas. The tail of pancreas was going to the hilum of spleen. So we will have a pancreatic region also, but above the pancreas, as pancreas was forming it was one of the structures forming stomach bed. So above the pancreas is gastric area. So up till now we have got 4 areas: suprarenal area, splenic area, pancreatic area, and between pancreatic and suprarenal we have got gastric area. Is it clear? Now we are left with the lower region. Lower region again are the same, just like the lower region here. That means colic impression, jejunal impression. Here also colic impression and jejunal impression. So this is the anterior relation of both kidneys, right and left. And this is very important, and you should know this because so many organs are related to the kidneys. So anything affecting one can affect the other. So we should know what are the organs. Now the posterior relation. In posterior relation, you know, the posterior surface of the kidney, it is going to be related to the posterior abdominal wall. So there is no organ present over there. So the relation is same. In the upper part, I mean just behind, the superior pole is related to, of both the kidneys, diaphragm. So it has got diaphragmatic surface because dome of diaphragm is convex like this, going down. So it is going down behind the kidney. So the upper pole of both the kidneys is related to diaphragm. So it has got diaphragmatic surface. And below the diaphragm, the kidney, if you just think for a moment here, that this is the posterior surface, okay? Then it will make you learn it easily. Upper part of both related to diaphragm. So it has got diaphragmat. impression. Then below the diaphragm here, see this, I have put this, my pointer here, below this area, it will be divided into 1, 2 and 3 parts. Means the medial, then intermediate and lateral part. The medial border is related to psoas major muscle. Psoas major muscle, because it is taking its origin from the body of T12, L1, L2, L3, L4, L5, you remember. So the medial surface is related to the psoas major. Then in intermediate area to quadratus lumborum. Quadratus lumborum of the lumbar region, isn't it? And outer is transversus abdominis. Transversus abdominis is one of the muscles forming the anterior abdominal wall. It is going back like this. Okay. So these 4 muscles are related to posterior surface of kidney. And we have got blood vessel and nerve of one area. What is that? Because T12 was related to the kidney. So below the T12 is subcostal nerve and subcostal vessels. So subcostal nerve and subcostal vessels are related to the posterior surface of both kidneys. And below that, ilio-hypogastric nerve and ilio-inguinal nerve. All these are also related to the posterior surface of both kidneys. They are quite similar. Now, you know about the shape of the kidney. You know about the characteristics, the shape, the poles, the borders, surfaces now. You know about the relations, you know about the dimensions, you know about the axis. Now, if we cut it in half, what we see? See in this diagram. I will shift on this side. Okay? In this diagram, you can see this out. This is light in color. This is the cortex, renal cortex. Renal cortex, and this dark color, you can see it's quite triangular in shape, isn't it? This is renal pyramids. So this pyramids are forming the medulla, and this light color renal columns, they are forming the cortex. So outer is the cortex. Outer is the cortex, renal cortex, and inner is the renal medulla. Renal medulla is containing renal pyramids, and you must be knowing the histology. In histology, how do you start? It is cup-shaped glomerular capsule, Bowman's capsule, isn't it? Filled with the glomerulus. Then PCT, proximal convoluted tubules. Then loop of Henle, descending loop limb. Then the loop ascending limb. Then DCT, distal convoluted tubules. Then collecting tubules. So most of the glomerulus, PCT, they all lie here in the cortex, and this in the pyramids or in the medulla, you can say this medulla, it is containing collecting tubules, and then at the end you can see here a papilla like structure, isn't it? They are ending like this. This is called renal papilla. Renal papilla is ending in where? Minor calyces. You can see here we have cut open this major calyx, so we can see one minor calyces here, one minor calyces here. Okay, so minor calyces open in major calyx. We have got 1, 2, 3, 4, 5, maybe 4 also sometimes. 4 or 5 major calyces, which a singular is called calyx, plural is calyces. So 4 or 5 calyces which have got minor calyces. So minor calyces join together to form major calyx, and all the major calyces join to form the renal pelvis, and then it becomes narrow and forms the ureter. Now I again come back on this side so that you can see here the ureter. Now it is passing downwards. Okay, it has started from the posterior side of the body, isn't it? And bladder is present anteriorly behind the pubic symphysis. So in the pelvis, the anterior-most organ is bladder and kidney is posteriorly placed. So the ureters, they are not so straight as they appear in this diagram. Instead, from behind they come to the anterior portion retropubically. Okay, so that is why whenever there is a stone or a renal calculi pain, it is always like this, oblique and downwards from loin to groin. Loin means the lumbar area. So loin to groin. So this is the ureter. It has got 5 constricting points, 5 constrictors, 5 areas where it is narrow. So whenever there is a stone, it shifts from these any of the 5 points. If it comes down, patient is in severe pain, a colicky pain. The patient is never in relaxed mood. He sometimes sits down, sometimes stands up, sometimes lies down, presses the abdomen with his hands, his or her hands, but doesn't get relief unless that stone passes that constrictor point. So it has got 5 constrictors. Then it opens here on the posterior surface of bladder, and the posterior surface of bladder, from when we see it from the inside, that means from the cavity of the bladder, there is a triangular area called trigone. Triangular. So upper 2 ends of this triangle, it is an inverted triangle. The apex is facing downwards. Apex will have an opening called urethric opening. Okay, and the base will have 2 ends on which 2 ureters will open. So the ureteric openings, right and left, are present on the upper 2 ends of the base of the trigone, and the apex is having the opening of urethra, urethral opening. So this is the ureter. Now we come, as in all organs we should know, the arterial supply, then the venous drainage, lymphatic drainage, nerve supply. It's very simple. You can see this aorta, abdominal aorta, isn't it? Abdominal aorta, it is giving directly one artery called renal artery, right and left renal artery, and it is drained by renal vein. But the story is not so simple. First of all, we will have to see the pelvis, the hilum, sorry. This is the hilum of kidney. You can see very clearly that vein is present anterior mostly. The most anterior structure is vein, V. Behind it is the artery. So V के बाद में क्या है? A. उसके बाद में है pelvis, VAP. You can also study like this, P for pelvis, P for posterior. So pelvis is present posterior most. Okay, so no issues about pelvis being anterior or posterior. P for pelvis, P for posterior. So if we have to learn the relations at the hilum of kidney, it is VAP. The pelvis is present posteriorly. But in the second diagram here, you can see that one branch of renal artery is going behind the pelvis here. So don't confuse yourself, because that has to be a little thinner than the real renal artery. So the pelvis is always present posteriorly. So the relations at the hilum of kidney is V, that means the renal vein anterior most, A means renal artery in the middle, and P, pelvis at the back posteriorly. VAP. Pelvis P, starting with P, it is present posteriorly, P, isn't it? So it's clear. Now this is not the only thing. When we talk about the arterial supply, this is the main artery, renal artery, but it is not going to supply just like that. It has to divide and redivide. First of all, it divides into 5 segmental arteries. Segmental, why segmental? Because it divides the kidney into 5 vascular segments. If you see this kidney here, above this point is the upper segment, below this point is the lower segment. Now between these two upper and lower segment, this is divided into posterior half. This portion is the posterior segment. Now the anterior segment is divided into two, upper and lower anterior segment. So we have got 5 vascular segments in kidneys. So the renal artery will divide into 5 segmental arteries. They will divide into, they have to supply the lobes, because you can see it has got quite lobular appearance, isn't it? See here also quite lobular. So interlobular arteries. The branches of segmental will be interlobular. In the lobular lobes, we have got here arcuate arteries, and from arcuate arteries again we will have branches given off like this. Okay, so we have got interlobar, then interlobular, then arcuate artery, then the branches from there. Okay, so this is about the arterial supply. And the reverse with the same name, the reverse is the direction of the flow of blood. Okay, the name is going to be the same. We will have to start from the periphery and then we will have to reach the renal vein. That is the venous drainage. Lymphatic drainage, here aorta is present. So near the aorta we have got para-aortic lymph nodes. So lymph nodes, lymphatics are draining into para-aortic lymph nodes. Now nerve supply, it is supplied by the sympathetic nerves. So this is nerve plexus actually. That nerve plexus is related to the celiac plexus. Where was the celiac plexus present? When we read about the celiac artery, it was supplying the foregut. Okay, so near the celiac trunk is the celiac plexus. So this is the nerve plexus is related to the celiac plexus. This is all about the nerve supply, arterial supply, venous drainage, relation, histology and the section of the kidney. Now we talk about the coverings of the kidney. It has to be covered. It cannot be lying bare, isn't it? So the innermost layer which is protecting it, the innermost capsule is here. It's called the renal capsule. Renal capsule which is covering it immediately and beyond it, because this kidney is present retroperitoneally and it has to be protected, isn't it? Because it has got no protection from behind basically, except apart from the muscles that we talked about: diaphragm, psoas major, quadratus lumborum and transversus abdominis. So it has got a very thick fascia which is covering the renal fascia, and we call it perirenal fascia or perirenal fat. Yes, fat. This fascia contains a huge amount of fat which gives a cushion effect. Previously, this perirenal fascia, it was divided into two parts. We used to say that the anterior layer is called fascia of Ureter. Posterior layer is, the posterior surface is covered by fascia of Zuckerland, and both of them were fusing laterally to form the conal fascia. And superiorly, they were covering the suprarenal gland and fusing at the upper as well as lower end. That means enclosing the kidney completely at both upper and lower pole. But now the new concept is that the perirenal fascia, it has got laminar nature. That means it has got many layers, and in between is present the kidney. And one more change is there, that superiorly they are not fusing. That means the superior pole is open. So on the right side, the upper pole is related to the bare area of liver, and the left upper pole is related to the subphrenic space retroperitoneally. So these are the changes that we have made in recent time about the fascia of kidney. Now, what about the surgery? When we have to do any kind of surgery for the kidney, we have to do it from the posterior side because it is present retroperitoneally. Okay. Now, applied anatomy. Applied anatomy, the first and the most important disease that we know is renal calculi. It can be present inside the kidney. If it is present, then it is going to give a dull ache posteriorly, and that area is called renal angle. Where is the renal angle? It is present between the angle between two things. Okay, any angle you must have learned in geometry is between two lines, isn't it? So one line is formed by the 12th rib, because 12th rib was related to the upper pole, and the outer margin of erector spinae muscle. So this area is called renal angle. Any pain over there, heaviness and pain over there, can be due to stone. Then it can be because of infection, glomerulonephritis. There can be one more infection, that is pyelonephritis, going from down to up. Then there are tumors also, Wilms tumor, renal cell carcinoma. So these were the diseases that we should be aware of in kidney. These are not all, because this lower pole can be fused also, and we can have horseshoe shaped kidney. One more thing, in embryology, means during development, the kidney is not present in the lumbar region. It is present in the pelvic region. Means it is present here near the bladder, and from here it is ascending upwards. Okay, so suppose it doesn't ascend, so we have got then the pelvic kidney. One more anomaly we can find is unascended kidney. We can have horseshoe kidney, we can have unascended kidney, we can have ectopic kidney. It can remain anywhere in between, isn't it? Then polycystic kidney. Polycystic kidney, when here the collecting tubule and the rest of the nephron, you know, globular capsule, PCT, loop of Henle, DCT, this is the part of nephron, collecting tubules. Both these structures are coming from different layers, the 3 layers of embryo. What are the 3 layers? Ectoderm, endoderm, and in between mesoderm. So the endoderm is giving rise to the nephron, the mesoderm is giving rise to the mesoderm gives rise to the nephron, that means the Bowman's capsule, PCT, loop of Henle, DCT. Collecting tubule, it is collecting tubules, see from here, collecting tubules, minor calyces, major calyces, pelvis, ureter, bladder. These are all part of endoderm because they are arising from the hindgut. So they are coming from the endoderm. So if one is coming from one part is coming, the secretory part is coming from the mesoderm, the excretory part, remaining part, the collecting part is coming from the endoderm. Suppose they don't fuse. If they don't fuse, the nephron will go on doing its function. So it will not be able to drain out its urine. So there will be a lot of grape-like structure. It will start bulging. So they start forming grape-like structures on the surface of the kidney, and that is called polycystic kidney. So these are the various diseases that we can see in applied anatomy. Thank you.